Ladies and gentlemen, this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Sean Keating.
Hey everyone, Sean here. Welcome to another episode of the Dental Up Podcast. Our guest this week is a graduate from USC School of Dentistry. He has operated his private dental practice for over 35 years, and he specializes in cosmetic dentistry and full mouth reconstructions. He served 10 years as an instructor of clinical dentistry at USC and has received numerous awards for his pioneering invention of the ISOLITE Dry Field Illuminator. Practicing from Malibu, California, please welcome Dr. Thomas Hirsch, DDS. How's it going, Dr. Hirsch?
Sean Keating, how the heck are you? Man, I got to tell you, with an introduction like that, I'm not even going to be able to walk through my doorway. You made my head so damn big, I'll tell you.
Oh, baby.
Thank you very much for those kind words. It's going well. How are you doing?
I'm doing fantastic. Thank you so much. Dude, I know how busy you are. You're a machine, man. You just have been so crushing it for so long, and just I can't thank you enough for coming on this podcast. And I know you don't have a little bit of time, but we're gonna try to talk. I know I did one. You were like my 5th podcast ever years ago, and it was real quick.
It's been a long time. It's been a long time. I don't talk to you all that often. Every now and then I'll see you at a convention.
Yep.
But literally working with you guys, it just goes so seamlessly.
Oh, that's so cool.
I never have to go up and speak to the big guy. I think you got just a superstar. He's my go-to guy is Bob Brandon, and he's my go-to guy. I got a problem or a question, I call him, and man, he's either right there ready to take my calls, or he just sits there and calls me right back almost immediately.
Oh, that is so cool. And I know, man, you'll get in that damn plane and fly down here and bust my ass if if I do something.
Oh, yeah.
Now, that's so cool, man. Well, I know last time we talked a little bit on the ISOLITE, but I kind of wanted to talk about it on this one for sure, because that's just such a revolutionary product that, you brought to the market several years back, and it's just changing the way dentists are practicing in their dental practice. But first, I always start off talking about sports a little bit. But, dude, I know you're in Malibu with all the stars and all this stuff, but what's it like with the Lakers now with LeBron and all that stuff and the Rams going off? I mean,
LeBron is just amazing with the Lakers. I mean, just incredible. I mean, that guy's an animal. And the Rams, I can't believe they lost this weekend, didn't they?
Yeah, they did. But
first game they lost, they were 8-0, and then they beat. Was it?
I think
the Saints get them. Is that who got them this year?
Yep, the Saints did.
I was thinking they were going to go for a great, perfect season. But still, 8-1 is pretty damn good, I'll tell you.
Oh, it is. And I think it's kind of a good thing for the Rams because, I think they had some work to do with that defense, that secondary especially, even that superstar millionaire Peters that they got out there at corner. He got burnt quite a few times the last few games. And, Talib, the other corner, has been out, but they got some new guys on the line. It's just it's going to take a little bit to gel. But even McVay, that coach, that young frickin', what is he, 31 years old? He's like, I think it's a good thing we lost. I think we'll learn from it. Yeah. I think we'll get a tighter edge. And so, they got the Saints as the number 1 team now. They got Kansas City number 2 and the Rams at 3. But heck, man, all that matters is that first playoff game and just getting to the playoffs and then just one game at a time. But it's just neat to see LA back in, the market with a football team, and then let alone to be playing like they are. I think it's huge. But I know all you guys.
It makes them know they're not invincible.
Oh, absolutely.
But hell, my Trojans, I tell you, they're sucking it right now.
I know, man. I'm feeling for Bob, and he big USC guy as you, and you went to USC, and my brother went to USC Dental School too, man. I know you guys are Trojans, man. Fight on, dude.
Hey, fight on, man. All the way.
They ask you for money every year. Those alumni, they come after you, don't they?
Every year. Hey, you got to support your school, got to support your team.
Oh, heck yeah. My last school I'm supporting is Stacy Junior High School, man. That's my last graduation. No, we better cut that out.
You graduated from junior high school? I didn't think you went that far.
Yeah, 8th grade was my last one. But hey, the Lord works in mysterious ways. please, man. He said, Sean, you make some teeth. You'll be okay.
Well, I thought your GED meant graduate elementary.
Yeah, exactly. I had to get that GED to get my CDT because they had to have something, but I did.
Yeah,
it's just kind of crazy, but how things work out. But that's funny. Yeah. All right, dude, let's dental up, man. So
let's talk some dentistry.
Tell me a little bit. Why did you get into dentistry? At what point did you think I want to be a dentist?
This is a really good story. So here it is. I am 16 years old, and we'd been skiing. You know, we started skiing when I was 14.
Okay.
The family took us up. We started skiing at 14. So now I'm 16, and almost 17. And it is a bluebird day. It has just dumped a pile up at Mammoth.
Okay.
So my buddy Dave says, Tom, let's go skiing. I said, Dave, we got school. He said, no, come on, let's go skiing. I said, big pile of powder up there. I got to choose my words carefully here. Yeah. Big pile of powder up there, and it's sunny. So we took off, headed out about 1 a.m. We get up to Mammoth about 7 o'clock, and we're on the slopes and we're skiing. So here I am. I'm riding up on chairlift number 3, and I'm sitting next to this really old dude. I mean, the guy was like 45 years old. He was ancient. And so we're going up there, and he looks at me and says, son, shouldn't you be in school? I think this guy's a truant. I was going to bust my rear end. And I said, well, what do you do, sir? Because I wouldn't answer the question. He says, I'm a dentist. And I says, you're a dentist? And he says, don't you have to work? He says, yeah. He says, Wednesday. He says, you know what I do, because I like to ski so much and I hate all these big crowds at Mammoth. So I work on the weekends and I ski during the week. And so I'm sitting there thinking about this. I said, wow, that sounds like one heck of a gig. So anyway, that's what got me interested in dentistry.
No kidding.
Was being able to write my own hours, my own time, and go skiing during the week, which I've done a lot of, by the way.
Yep.
But, you know, not like I would have dreamt I would have done. I thought I'd be working, you know, Thursday, Friday, Saturday, Sunday, and skiing Monday, Tuesday, Wednesday. Yeah, we all know that doesn't happen.
Yeah, exactly.
You get married, you have a life, you have kids, this and that, and so there's a whole lot of stuff that comes between it. But that's why I started, was just because I like to ski and I like to write my own hours. And plus, my dad, who's just a great man, said, you know what, Tom, you don't want to work for somebody else. He says, you want to be your own boss.
Exactly.
He says, just find a job where you can be your own boss. And so that's what we ended up doing here.
That is.
And I just made that recommendation to my youngest child. She's 18. She just started her first year of college. She's in Texas right now because she wanted to get out of Dodge for a while.
Yep.
So she's off in Austin right now going to school.
Ah, that's so cool. My best friend lives in Austin, man. I go out there every once in a while, but it's a hot state in the summertime, and it gets pretty hot and humid out there. But
she's finding all about that. I mean, she was just the sheltered little girl in Malibu. Now she finds out what the real world is all about.
Oh yeah, it's a different world there. I mean, they got a lot of good food and good music and stuff like that, but it's no ocean front, you know, Malibu, like you live a couple miles from the water, you know. Your practice is like, it's such a bitchin' practice that you have, dude. Yep. So that's awesome.
I'm lucky.
That's a great story, dude. Hey, I just seen too the little jet suite, you know, the planes, they're going out of John Wayne here to Mammoth now, and I'm like, you know, that 5-hour trip on the car it's a pain in the ass to go out there to get to
it is.
Mammoth.
I mean, you can be up there in an hour.
Exactly.
See, and that's Sean. That's why I got my pilot's license. Yep. The reason I did that is because I hated the drive to Mammoth. Now, my dad tried driver's education, driver training in high school, so, you know, he was a really cautious, careful driver.
Yeah.
But that drive to Mammoth, it could take us 8, 9, 10 hours sometimes.
Oh, yes.
I figured, I don't want to make that anymore. So the first thing I did when I graduated dental school is got my pilot's license.
Can you
very first thing.
That is the
So
coolest.
I've had that sucker since 1971. I got about 5,000 hours.
Can you believe that? And no, I remember the first case we did. I met you at the Hinman. Our booth met each other 15 years ago or whatever.
Oh, let me interrupt here and tell you the story, or tell your people that are listening to this thing the story. So here I am. I'm new at the dental conventions. I just invented the ISOLITE, and I'm sitting there, and my booth is right next to Sean's, and I'm talking to him, and he's talking to me, and I'm looking at this stuff, and man, this stuff looks really good. I mean, I'm kind of anal about my dental work and the quality, and so I looked at this stuff, and I said, Sean, this is just great looking stuff. And he says, okay. And I said, but the first case I'm going to send you, it's actually a full mouth reconstruction. Yeah. He says, well, how many units? I said, 28, 28 preps. And I said, I'm prepping it Monday. And he says, well, great. He says, when? I said, well, how long will it take you to get it finished for me? And so, Sean, you told me, when do you want it back? And I said, well, when can I have it back? He says, you tell me when you want it. I said, well, how's the following Monday? And he said, no problem.
Yeah.
So I sat down there. I prepped that thing. I jumped in my plane. It took me all day to prep upper and lower arch. Jumped in my plane, flew it down there. You met me at the airport.
Yep. I couldn't believe
picked
it.
this thing up, and I had it in my office 7 days later, and I cemented that thing 7 days later, and it went in 27 out of 28 units were perfect, and one crown was high. You were high on, it was either 15 or 18. I forget which one it was, but I was off somewhere back there. But man, it was just spot on. It looked great. So, you know, you're the man in that aspect where you say, hey, when do you want it? And I get it. And the same thing with Bob. I call Bob up all the time, and I'm saying, I said, I need this thing. And I know this is really short notice. I said, when do you need it by? And 99 times out of 100, you deliver. You deliver. Sometimes it just physically can't be done. If we need some custom abutments or something like that, and you just got to send it out to someplace else, it can't be done.
But we will. We'll get it. Anything that we possibly can do for you, we will, as with anyone. But with you guys especially, I mean, because we do so much big work through the years. And, man, all the stars. We can't even talk about a lot of them. But I remember the one we just did, Johnny Rotten, man. That was kind of cool. He's got a big concert he's doing now. He's doing like a big tour with his, I think it's called LTD or something, his other punk group. I forgot the name of that one. But.
Oh God, yeah. I went to one of his concerts. I didn't have cotton balls thick enough for my ears.
Oh, I know. It's so,
oh my God, that guy's loud as hell.
Oh, he is. And he used to look horrible. I mean, his grill was kind of messed up. Now he's looking pretty hot. Isn't he?
You did a great job on that.
Oh man, that's so cool. Yeah, Johnny Rotten. That's awesome.
I'll tell you another one. Kris Kristofferson, he just did a new movie. I forget what the movie he did, but he sat down there, and you've done work on him too. But God, his movie was just stellar. I mean, he was so good. He plays this old cowboy or something like that. Man, great job.
Really?
Great job.
I got to watch that. I'm big into Westerns lately. God, I'm getting old in my age. I'm sitting there watching, what's my new favorite show? It's on one of those old channels on cable. Oh, it's The Virginian with James Drury. I love that guy.
That and the Rifleman and all those things.
Yeah, they're like 60s.
Bonanza.
Yeah. I mean, I seen Bonanza so much, but I never seen The Virginian. But yeah, I love
that. Yeah, I got a hot tip for you guys here.
Okay.
Just kind of figured this one out. When we're getting ready to do some implants, and we make surgical guides because we want to know where all the teeth are.
Exactly.
And I'm going to probably steal a little business from you here, but I think it just really help your people out. You know, when you make a radio opaque denture, so we know
it's radiographic
where we're going to put the implants.
Yep.
Yeah, it's just radio opaque so we can go in there. I was talking to Bob, and we came up with something where we're actually radio opaquing the teeth because I needed some radio opaque paint to put on these things on a denture that we'd already done because I wanted to streamline it a bit.
Okay.
And he said, you know what? We got all this zirconia powder all over the place. So he sent me some zirconia powder, and what I did is I mixed the zirconia powder up with some bonding agent, and I painted it on the labial surface of the teeth of the denture.
Okay.
And then we scanned the denture in our CT scanner and our cone beam scanner while it was in the patient's mouth. And so you get this great outline of where all the teeth are, the labial surface of all the teeth, so that when you're planning your implant positioning, you can put it so it's not coming out through the facial surface. So if you're doing any type of restoration, be it a denture, an all-on-6 or an all-on-4, or if you're doing crown and bridge, you've actually got these things going in the right spot. You follow what I'm saying?
Yeah, that sounds kind of neat. Let's not talk too much about it and maybe get a little patent on this thing. No, let's... No,
I got some patents. Too much damn work to get patents these days.
I know, believe me. I've done the trademark patent thing, and dude, it's best not even getting involved with those lawyers.
Yeah,
man.
It's just technique. It's just kind of something to share with your people that if they have a problem, because I sat down there and I was trying to figure out how the hell are we going to make this thing work? And I was trying to figure out different things that I could paint on the teeth that weren't toxic to the patient.
Yeah.
And I couldn't come up with anything. We can use gutta percha, but Di-Cal works. But this stuff works really, really, really good. Mix it up with some radio-opaque bonding agent, put it on the denture, then you can cure it so it doesn't rub off in the mouth, and then you can scrape it off.
Oh, that's so awesome, dude. No,
that's just the tip of the day.
That's great minds thinking right there. I'm gonna talk with Bob on that. We'll get a little spreadsheet on that and pass that on to our other doctors. We'll get all our zirconia dust and get it in packets, man. We'll give them like kilos out. Do you need a half key or you need a?
What was that Tom Cruise movie that just was? I forget. He's this guy. He starts working with the CIA and he ends up smuggling all the cocaine
it's a great
from
movie.
Pablo Escobar down from Guatemala and Nicaragua. It was funnier than hell.
Yeah, I watched that. That was great.
Packets of white powder, because our white powder is going to be zirconia.
Yeah, that's it. I thought of you when I seen him flying it all crazy, because I pictured you in your shorts and flip-flops getting off that plane. And, John Wayne Airport's an international airport, but right next to it is ACI, the little, where all the private jets. And here I am sitting there waiting for you. And I'm 2 minutes from it, so I drive up. Here you are with a full box of, upper lower roundy and your flip-flops and shorts off this plane. I'm thinking to myself, dude, what happens if you're up in the middle of the air by yourself and you just have a hiccup or something goes wrong? It's kind of ballsy, man. It's just kind of so nuts. But it takes a special person to get up there and, by yourself to go across the ocean like that, or just you probably just chase the ocean all the way down, right?
No, we have fun. Sometimes we go real low on this thing. Oh, here's another tip as far as guided surgery. You talk about flying and this and that.
Okay.
Whenever I'm doing my implants, I do it with surgical guides, and you really got to trust that you planned it right, and trust your surgical guide, and trust the instrumentation that you have in your hand. It's just like flying when you're doing an IFR approach into an airport when it's all foggy. Oh, yeah. You've got your instruments right in front of you. And you got to trust those things so that when you break out of the fog, you got to know that that's where the runway is going to be. And so when you're doing your guided implant surgery and doing your osteotomies, you got to trust that you actually planned it properly. And you do everything just
it's so
right
true.
down the way.
You should see some of the stuff we get where they're not using those guides, and it's everywhere. And it's like, we're pretty good at not starting those cases anymore. We tell the guys, well, we think you got to send it over to Root Lab or one of those other labs, because I don't think we have the capabilities of doing it with it's out in left field like that. But that is so true. I mean, that's how John F. Kennedy Jr. died, didn't he?
That's right.
He was in the fog over there by Nantucket, and he didn't know what was up or down, and he didn't know how to read his gauges, I guess.
No, because he's trusting what he's feeling in his body. I mean, you can picture this whole thing. I mean, we may get a little politically incorrect here, but you can picture he's flying this thing. He's in the fog. He's not really very well trained, and his body's telling him that he's turning the plane to the right, so he's compensating going to the left, and then he's got his passengers in there that are just yelling and screaming at him, hey, do this, do that. So he's got input coming from all over the place.
Oh, I bet.
And you can't have that. You got to be totally focused on what you're doing and just know that you're right and plan it.
Yeah, it's so. I mean, even on my boat, man, when we go over to Catalina, it's like 30 miles across the water there, and you can see it and when it's clear, but a lot of times you got this haze and the fog rolls in, you can't see 5 feet in front of you, and that's all on radar, and it's scary as hell, even because you got to trust it, and then you got to look for all the other objects that are out there, and it's scary as heck, man. I hate going out fishing or anything when it's foggy, because I just get it's just a weird thing there. Well,
I don't blame you there.
Yeah, kind of crazy. Well, dude, tell me about this ISOLITE. Now, that is the neatest thing. I mean, it's where a dentist can practice without assistance and stuff like that. Tell me how you started it, and tell me all about the ISOLITE if you could.
This goes back a whole bunch of years, back to 1984 when fiber optic handpieces first came out, and I had Midwest America's first fiber optic handpieces. And the way that my office is set up is I have big picture windows, so I never wanted to have anything in front of the patient, so everything was all side delivery and rear delivery. Well, in one of my rooms, the fiber optic bundle from the light source was draping across the floor, and I kept rolling my chair over the bundle, breaking this thing, and so I was destroying these $300 bundles, and these were $300 in 1984, so that's like a $1,000 bundle today or a $1,500 bundle today, and it takes just exactly 2 passes of the wheel of my chair to go over this thing before it was gone. So I bought 5 or 6 of these things, and I could not retrain myself not to roll my chair over the cord when I was all finished. I was proud of what I did, so I kind of pushed back. Oh man, that looks great. Bump, and shit. So anyway, I couldn't do that. So one day I'm looking at this thing. I said, why the hell's the light box over there when I wanted the light in the mouth. Why is the light source on the right and I want it in front of my patient's mouth? I said, I'm going to put a light inside the patient's mouth. And so that's how the idea came up. And so I was talking to my brother, who was an industrial designer. And I said, Jim, we're going to put a light inside the mouth. And he said, okay. And so he did that. And that's how we started the company.
Jeez.
But it took me another 15 years to put it all together and for technology to catch up with the idea. And then once technology caught up with the idea, we went ahead and started this company. I mean, it was on a shoestring. I went out to my friends and family and raised as much money as I could, and I was short by about a factor of 4. Needed 4 times as much money as I thought.
Oh, man.
And we almost went bankrupt a bunch of times, and we mortgaged our houses, and I ended up mortgaging my plane, and I sold my condo up at Mammoth just to get money to fund this thing. And it took 4 years before we actually became profitable. We lost a ton of money in the first 3 years, just, making everything and getting it to market. But then ever since then, it's just been great. And the latest development that's come up with this is we've just launched something called the i3, where we totally redesigned our ISOLITE, and we put in an actual amber cure-safe light in that thing, so you can turn the light on and get as much light in the mouth as you need, and it will not set your most light-sensitive material, your bonding agents or composite or cements or anything.
No
you got all the time in the world to work.
Now, what about the suction with it too? How's that? I mean, it's kind of an all-in-one, isn't it?
Oh yeah.
So explain it to me for some of the people because it's more than just a light. Yeah. It's also
more than just a light. Yeah. So what this is, first of all, on one side it has a bite block, but the bite block is kind of a soft polymer material, so the patient can rest and they can close down on it if they want. So now they have a place to rest their jaw.
Yes.
So their jaw is not. They don't have to strain and keep their muscles open to keep their mouth open. So that's number one. We have suction in this thing, so it suctions from all areas of the mouth, behind the bite block and down on the floor of the mouth and back of the buccal vestibule, the back of the throat. It vacuums up all the water. It protects anything from going down the throat, either into the trachea or the esophagus, so nothing's going to go into an airway or be swallowed into the stomach. I mean, it happens on occasion, but not with the ISOLITE. It protects the tongue and the cheeks from getting cut by the burr.
No kidding.
It keeps the area isolated and clean, so you can do whatever dentistry you want to do. Bonding in a dry field, the patient's wide open. They're well lit, and the area is nice and dry. You're controlling all the humidity and all the moisture in the mouth.
Are you able to use a rubber dam with it?
You don't need to use a rubber dam. You can if you want.
That's why the rubber dam is to keep it isolated.
Yeah, it takes the place of the rubber dam. So this gets you isolation with all that the hassle of the rubber dam, and you can work on the upper and lower quadrants at the same time. So with one ISOLITE mouthpiece, they're disposable, so you use them once, you throw it away, and you're always assured of a sterile, clean mouthpiece going in the mouth without any cross-contamination or without your assistant having to take time to clean this thing and keep track of if it's been autoclaved or not. Use it once, you throw it away, and it's only about $2.50, so it's cheap enough.
Yeah, absolutely. Yeah. Do you see a lot of the practices like not using assistants or use it with an assistant? Or no,
It really doesn't take the place of an assistant because your assistant is your right hand.
Yep.
So what it does, it actually leverages her time. So while you're working in the mouth and while you're drilling, everything is it's isolated and it's dry and it's evacuated. So your assistant is in the room. She's getting everything set up for the next part of the procedure. Or if need be, she can split and go into the other room to take a set of x-rays or do something in the other room and get the other patient ready for the next procedure that you're going to work in the other room.
No kidding.
So you can leverage your time that way because honestly, your assistant's the busiest person in the office. She's much busier than the dentist or anybody in the front desk is. She's the hardest worker there.
I bet.
And so you really got to make her job easier. And so my assistant, even if we're doing something as simple as an occlusal filling, let's say on number 30, my assistant, and I'm not going to put the ISOLITE in, she makes me do it because it just makes life easier for her and gives me a better clinical result.
That's so awesome. No, it really is. I remember back in the day when it just came out, it was like revolutionary. And I just thought And I'm like, I know this dude, and I know your brother's a great guy too and stuff. And but just what a great thing for dentistry, and it's still going strong. And I'm thinking, I got to talk about this now. What about with I got to do some of our Dental Up listeners and stuff. We got to give. I got to do some of this where I'm always giving stuff away at different conventions, stuff like that. We gotta start giving some of those isolates away. You got any specials on them, 10% off or anything going, or do you do any specials, or can we do a special for any of our people out there?
You know what? I think we could do a special. You kind of caught me off guard with this one, but I'll talk to my marketing people there. And for anybody that's calling in for Keating, we can give them a special, maybe 10, 15, 20% off, something like that. I don't know exactly what it will be, but absolutely we'll help you out there.
Let us know on that. We'll put it up on the website for sure when we put the podcast, and to do a special promo code with Keating, and you'll get a discount. But I think it'd be great. And then I want to do it too for, holidays are coming up. We like to give back a little bit here and there. I'm always doing things with, either AMD lasers or whatever, The price point is nice. It's just, it's perfect. And just, I got a lot of doctors that are in small little towns out there. And I just think it could help. Like, even if you still have your assistant she can do more and, or they can do more and, practice
the deal
smarter.
Too. Yeah, here's the thing also. I mean, we've got 3 different models of this thing. We've got one with a light, we've got one without the light, and we've actually got an ISOLITE we call it the ISOVAC that goes right on the end of your high-speed evacuator hose. So, for people that are, let's say, in an area that maybe not be quite as affluent and they're kind of struggling and they've got to watch every nickel and every dime, this is a real nice way to get into it with the ISOVAC that's really relatively inexpensive.
That's so perfect. We'll have to get a link to your site and everything else, guys. I'm looking at my guys. Let's get that. So, because I just think it's great. You practice smarter, not harder, and this just really helps out. And I just remember when I did it way back in the day, and I went in and I just love that block in the mouth. I mean, because no one ever had those before, and you're always holding your mouth up, and then you kind of nod off, especially if I'm on the nitrous, like my buddy. It's like, Sean, open up again, man. You're starting to, eyes are rolling back. Come on, wake up now. But with that block,
wake up, buddy.
But that block, man, it's kind of neat, and it holds it open, and you're not tensing up and stuff. So just that. But no, that's awesome. What a great product, and that's so awesome for sure. We're gonna help you out on those, because I want a lot of my clients to get that. If they don't, I think it'll just it'll improve their practice for sure.
It improves your end clinical result, and it allows you to do things in half the time. Well, not half the time. Some of your procedures are half the time, but maybe you're finished in 30% less time. So let's say you're doing a crown prep and it takes you an hour and a half to do the crown prep. Yeah, you'll be done in 40 minutes. If it takes an hour and a half, you'll be done in an hour. It just makes life easy.
Oh, heck yeah. That's what it's all about, man. That's what we try to do in life, to find things we can do to make our lives a little bit easier. And
let me tell you one more thing that I found.
Okay.
Sit down there. You guys do such a great job. You know me, I've been with you, 15 years now, more or less?
Yep.
Maybe 15, 16 years.
Absolutely.
And you've kind of seen me come full circle, where I was doing everything with you, and then when I got my CEREC machine, you found me falling off as far as the amount of business that I sent you.
Yes,
that went for a while. But I got to tell you, I love CEREC and I love CAD/CAM dentistry. But when I got to sit there and spend all the time milling, designing and milling and this and that, it just takes so damn much time. So I've almost come full circle now, where you're back doing almost everything again.
Oh, I know. I love it, man. It's like Hirsch is
you just make my life easy.
How's your practice doing this year? Is it booming? Like it seems like it with us for sure. For your
we've had an interesting year where we have been really busy, and then we get really slow, and then we get really busy and really slow. I mean, I've been slow for the last week or so.
Yep.
And then all of a sudden, today somebody walks in and we've got a bunch of implants we're planning, and then somebody else walked in with a broken tooth. He came in for a second opinion. Oh, here's a good one. Guy went to the dentist. 28 through 30, 3-unit PFM bridge. 30 and 28 are root canal. Bridge has been in about a year. 28 either got decayed or fractured off, comes off in the guy's hand. He's eating some soup. He pulls this thing out of his mouth. So either they had it in with provisional cement or something got contaminated. Now 28 is shot. So the guy said, well, here, this is what we're going to do. We're going to take out 28. We're going to do a 4-unit bridge. So he came in to see me this morning for another opinion. And I said, well, that's one option that you could do, and it can be done pretty expediently and pretty quick, but that really isn't what I do in my mouth or in my office. He said, well, what would you do? I said, well, I'd certainly take out number 28. You're going to lose that for sure. But then I just put 2 implants in. I put an implant in at 28 and an implant in at 29. And he says, so you wouldn't have to grind down number 27? And I said, no, we don't have to touch that tooth at all. It's just fine. He said, I like that a whole lot better.
Look at that.
And so one of the things that just never, and this guy, he's an engineer type type guy, so he asks a ton of questions. And, never be afraid to tell the patients what they really need and what you'd put in your own mouth. Because, sometimes you wonder, well, God, maybe they just want to do it this way or they want to do it that way. You got to give your patients the option.
Yeah,
Let them make the choice. Lay it all out. Say, we can do this or we can do that.
Absolutely. No, that sounds like good advice to me. So what are you doing? I know you're in just a nice, super nice area, but what do you do for marketing there? Are you doing much of the interweb with like Facebook, or are you doing, mailers? Tell me a little bit about
I don't do any external marketing per se as far as mailers or this or that. Okay. We've got our Google search engine, and Amy came in here, and I've always kind of shied away from Facebook and this and that. I just don't want to do it.
Yeah.
So she kind of took it over. Amy kind of took over my media aspect, and so we've got a search engine optimization company that kind of optimizes us, and we pay them $1,000 a month to do whatever they do. And honestly, I don't know what they do.
Yeah, I see you out there.
I don't know what they do.
I see
but
it,
they sure drive a lot of business here. We get a lot of responses. So we're doing a lot of, I guess I'm going to call it internet marketing, if you will.
Yeah.
And then we got a Facebook page, and I guess we got this page and that page, and we got a Yelp and blah 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 blah. I mean, honestly, I don't know.
Yeah.
I don't know.
I don't know either. I just see it, like I'm new to it too, and I get on there, but I see yours and I like it. Because that's what I do. If I like it, I'm going to say like, and so I just. And
then what we do, we ask all of our patients to always give us a rating or review us. A Google.
Yeah,
I guess it's Google. Don't you?
Well, what's the latest piece of equipment you've got in your practice? Probably is it that cone beam, or I know you already had the CEREC. Anything else?
I'll tell you the coolest thing that I got. I was at a convention, and the company Practicon. Practicon they got a lot of dental products, and it's called Practicon. They got this cool little electric, with PVS and pressure material like Imper gum and stuff like that. How hard that stuff is to squeeze out of the guns.
Absolutely.
And you got these big old machines that sits on the wall.
Yep.
Well, Practicon made this gun. You put your cartridge in, it's an electric motor, and you got your tip on there. You squeeze the trigger, the stuff just pops out and squirts right in the tray, and it's awesome.
That's so cool. I remember before you'd have to get scissors and just cut off the little tip and just load it.
Oh, my assistants get sore arms putting this thing in, but this thing goes lightning quick. So you guys, if your assistants are complaining about squeezing all that stuff into the trays, this thing from Practicon is really pretty cheap. It's about $250, $300.
We'll put that on too.
Practicon. Yeah, and you put that thing there, and so that's something that I found. And then the zirconia powder.
Yeah,
I'm still dialing that in a bit. I don't, know exactly if there's any other better way to do it, but that's the best way that I found so far. And what else?
That's so cool. We got some new tips and techniques from Dr. Thomas Hirsch from Malibu, California.
Hey, Sean, what's new in your lab? Anything exciting?
We're just really rock and rolling it. We're just doing a lot of monolithic. Our Bruxer and our Bruxer aesthetic. It just seems like we're setting records each month with it. And it's such a neat product. We used to do so many EMACs back in the day, like thousands of EMACs a week. And, at $143 or so, $153 with a micro layer, they can get a little pricey for some praxis, but they can go to the monolithic that the aesthetics are just rivaling the Lumina, what is it?
What you should do is you should
lithium silicate. I'm sorry. Try to get that out. Go ahead.
Yeah, spit that one out.
Yeah.
What you should do is you ought to send out some recommended instructions for the monolithic zirconia as far as what actually bonds. What is it? The MDP molecule? What is it? There's a certain molecule in the cement that bonds to zirconia. So you don't have to rely on retention to hold these things on. I think it's MDP. Clinical application for bonding to zirconia. The ideal protocol for eluting a zirconia crown onto a preparation lacking resistance and retention would be treat the zirconia surface with an MDP-based zirconia primer such as Z Prime Plus. I just said that because I'm reading it. I'm not recommending it.
Okay.
And so anyway, so something that has an MDP, people need to know that.
Okay, absolutely. We're going to get that info out for sure. We have it all on our site too, on different, products that we recommend. But, well, hey, man, I know you got to get back. I can't thank you enough. Dr. Hirsch, man, you're the man, and I love you so much, and can't thank you enough.
Anytime I can help you, I'd love to talk to you. You're always fun to talk to, and, you come with my highest recommendations. I love your lab. I love your work, and, I love the quick turn times that I get. I can sit down there. I can prep it. Single unit, multiple units. I can prep it on a Monday. I can have it back the following Monday, and if I really need it back, you get it back to me really fast.
Oh, man, we can get back in a day or two if you want. We just fly it on down to you. I got to get my private jet and get on down.
You're going to get right in your jet, huh?
I can't fly it.
And then when you're right over my office, you're going to drop off one of those little drones, huh?
Yeah, I'll drone it right down with my, I forgot the name of it, but we've got those drones, man. They're amazing. We do a lot of videos.
Okay, guy.
All right. Hey, Dr. Hirsch, thank you so much. I love you, man. And you need anything, just let me know, big guy.
Okay, Sean. Good talking to you.
All right, baby. Talk to you soon.
Okay. Bye-bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.